I'm Dr. Scott Raub with Vail Summit Orthopedics and Neurosurgery. I am a board-certified physiatrist, which is a physical medicine rehab doctor, and pain medicine doctor. I specialize in non-operative spine and interventional pain. Today we're with Vail Valley Live, and we are going to be answering some questions for some people in our community. All right, well, here we go with our first question for today. When should I give up on physical and massage therapy and see an orthopedic specialist for my neck pain? That's a great question and a common question that we get. In general, if physical therapy or massage therapy isn't helping, I would say in about 3 weeks or showing any progress in 3 weeks, well then I think it's time to get a specialty evaluation. Of course, if you're having not just neck pain, but you're having pain down your arm or numbness, tingling, or weakness, that should be a trigger to go to a specialist far before 3 weeks. Second question for today. Is it true that 90% of spinal conditions do not require surgery? If so, what treatments do you typically prescribe? 90% is maybe high, but it's close to that. Most people that have back pain don't require surgical treatment, and that's why I'm here. Most people will start out with physical therapy. Oftentimes, if it's really acute, oral anti-inflammatories, prescription strength, or oral steroids. And if they're not improving, other things that we consider would be injection therapy. And ultimately, if they're not better with that, then we assess whether they have a problem appropriate for spine surgical consideration. How can I manage my back pain while still enjoying the ski season? First off, you got to look at flexibility. You're in a crouch position. Maybe you should be working on hip flexor stretching. Of course, everybody talks about having a strong core, not so easy to do. Probably the best thing to do if you're really feeling like your core is weak is getting in to see a physical therapist to get proper stabilization training. But a lot of the stretching that people need to do would be focused on their hips, their psoas muscle, which is a hip flexor, their buttock muscles, and their hamstrings. Fourth question, are injections going to cure me? No. However, injections can be very helpful in reducing pain so that you can do the physical therapy if you're in that much pain that you need PT. Many people are using injections for management of symptoms. So I have a lot of patients that require injection therapy to optimize function, reduce pain. All of our injections are done under live imaging called fluoroscopy. They're done at a surgery center, and they're done with or without sedation per the patient's preference. But they do not cure you. They can help manage your pain, especially in situations where your symptoms are recalcitrant or not responding to medications, massage therapy, chiropractic physical therapy. And of course, after an evaluation, we've made sure you have something that we think can improve with an injection. I'd like to thank Vail Valley Live for having me today. If there's other questions, please feel free to reach out to us here at Vail Summit Orthopedics and Neurosurgery. I'm Dr. Scott Raub with Vail Summit Orthopedics and Neurosurgery. I specialize in non-operative spine, and I'd be happy to see you if you need me.